The following is a selected topic taken from my recent coding clinic commentary. My name is Barry Libman. Coding clinic addresses the reporting of a chronic cerebrovascular accident or stroke. There's a lot to consider to code this diagnosis correctly. First, the selection of our principal diagnosis or first listed condition. Second, the sequencing of the diagnosis codes. And third, the selection of the code to report the secondary or additional diagnosis. Our clinical information tells us that the cause of an elderly patient's fall is documented as chronic gait instability due to a chronic cerebrovascular accident. And our question is, how is this chronic gait instability due to a chronic CVA correctly reported in ICD-10 CM? The answer recommended by Coding Clinic is to report two codes, I69.398, other sequela of cerebral infarction, and R26.89, other abnormalities of gait and mobility. Coding Clinic explains that despite the fact the index leads us to code I63.9, the code for an acute CVA, whether the CVA is acute or chronic, the terms acute or chronic are not essential modifiers. Coding Clinic reminds us that we must appreciate from the diagnostic statement that this chronic gait instability is a sequela of the CVA and is assigned to a code from subcategory I69.3. Let's review sequencing. I69.398 is sequenced before R26.89 based on the instructional term at code I69.398, which says to use an additional code to identify the sequela. You will recognize this inflexible instructional term as part of the Etiology Manifestation Convention from Official Guideline 1A13 on page 11 of the current year's guidelines. And last, we discuss the code selection for the diagnosis of chronic gait instability. When you refer to the index at the main term instability, you will note that there is no subterm gait. So how is this diagnosis reported? Coding Clinic instructs us to report gait instability as gait abnormality. In the index, at the main term abnormal and subterm gait, we are instructed to see the main term gait, a bit of an unusual instruction as gait is not a condition. There, we find no main term gait, as promised, but we find the main term gait abnormality. After reviewing our choices of subterms, we select R26.89, gait abnormality, specified type, not elsewhere classified, because our gait disorder is specified as chronic and as instability. Thank you for listening. If you have questions or comments, we would very much like to hear from you. Happy coding!